Because you and me are living now, and we've seen the impact of food, what it has done from probably, in the 80s. Because in the 80s, before the 80s, there was no cancer in Africa. There was no HIV in Africa. There was no these chronic
opportunistic diseases.
Yes, exactly. So when these things, Western culture came, we find that a lot of these diseases came along.
Let's be more specific.
Yeah.
Let's look at teenager, premature maturity.
Yeah.
Where an 8-year-old kid
has got breast.
Is already on periods.
Yes.
A 9-year-old kid is already on periods.
Steroids.
So the way you breed chickens, the genetically modified chickens, which are these ramtutus, which sit in a thing and they just morning and evening and they're eating. 6 weeks later, they're already in the restaurants.
Yeah.
And the one that must run on the fields and etc. And you look around and say, which chicken tastes better?
Yeah.
Which chicken is healthier? And if you can take the same model of overbreeding and overfeeding these kids, and when they come out as children, and they mature at the age of 8, 9, and 10, entertainment, etc., does not make it easy.
Yeah.
Now they already have the breast and the bums and the small little six-pack that justifies that they are now mature. Entertainment says this is what adults do. They look at themselves, they already have the items, and so morality cannot be divorced from that. Our kids are maturing far much faster than they used to. In the olden days, kids would start periods 16, 18, in some certain cases, even 20.
Yeah.
You begin your first periods.
Amenorrhea,
Can you look within the past 15 years, if not 20 years, that actually the monthly period cycles have actually shrunk at 2 to 8 to 9 years.
Yeah.
And boys are beginning to have wet dreams at 7, 10, 11, and 13.
Yeah.
Now, take that picture and say, morally, when kids must be experimenting and doing mistakes early, checking if their instruments are working, they already come up with liability.